Hello, and welcome to Smish TV. Today, we delve into the Canadian healthcare system, a topic of much debate and criticism. Let's begin by understanding the foundation of Canada's healthcare. It operates on a publicly funded, single-payer system, ensuring universal coverage. This system is often lauded as it guarantees every Canadian citizen access to healthcare services regardless of their financial status. It's a commendable ideology, one that prioritizes human life and well-being over financial gain. However, beneath this noble facade, the system struggles with numerous challenges. One of the most significant issues is the long waiting times for medical procedures. Imagine a scenario where you are in pain or discomfort, yet you are told you must wait several weeks or even months to receive the necessary treatment. This is the reality for many Canadians. Studies show that Canada has one of the longest waiting times for medical procedures among developed countries. For instance, the median wait time for orthopedic surgery can be as long as 42 weeks, nearly a full year. Adding to this challenge is the shortage of doctors and medical professionals in the country. The doctor-to-patient ratio in Canada is alarmingly low compared to other developed countries. For example, there are approximately 2.7 doctors for every 1,000 people. This scarcity of healthcare professionals translates to less time per patient, longer wait times, and ultimately a decline in the quality of care. Moreover, the healthcare system is also grappling with an aging population, which puts additional strain on the already stretched resources. This means an increased demand for medical care, further exacerbating the issue of long waiting times and lack of healthcare professionals. Indeed, the Canadian healthcare system, while praiseworthy for its universal coverage, faces significant challenges that cannot be ignored. It's essential to understand these realities before making the decision to migrate. The grass isn't always greener on the other side, and this holds true for Canada's healthcare system. Now, a glance at how Canada's healthcare system stacks up against other countries can provide some perspective. Let's initiate our comparative analysis with our neighbors to the south, the United States. While the US does not have universal healthcare, it does boast a higher quality of care. According to a 2023 report by the Commonwealth Fund, the US ranked first for healthcare quality among the 11 countries surveyed, while Canada was positioned at number 10. This is a stark contrast that highlights the gaps in the Canadian healthcare system. Moving across the pond, let's consider the United Kingdom. The UK's National Health Service, or NHS, is known for its efficiency and accessibility. In fact, the same report that placed Canada at number 10 for healthcare quality ranked the UK at number 1 for access to care. While Canada's system is universal, it struggles with long wait times and access to specialists, which is not the case in the UK. Next, let's hop over to Australia. The Australian healthcare system is a hybrid model combining public and private healthcare. This mix allows for both universal coverage and the option for additional services at a price. Australia ranked higher than Canada in the overall healthcare ranking, coming in at number 2, just behind the UK. The takeaway here is that universal healthcare is not a guarantee of quality or accessibility. It's a complex issue with many variables at play, and while Canada's system is far from the worst, it certainly isn't the best. So, how does Canada fare in terms of affordability? Interestingly, despite its universal coverage, Canada has higher out-of-pocket costs than the UK and Australia, both of which also have universal healthcare systems. This is another area where Canada could look to other countries for improvement. As we can see, Canada's healthcare system, despite its universal coverage, is not the best in the world and has room for significant improvement. To wrap up our discussion, let's summarize the critical points we've covered about the Canadian healthcare system. We've learned that one of its most glaring issues is the long waiting times patients have to endure for medical procedures, which can be a source of great distress. This is largely due to a shortage of healthcare professionals, a situation that is only expected to become more severe in the coming years. When we compare Canada's healthcare system to those of other countries, it becomes apparent that there is room for improvement. Many nations have managed to deliver high-quality healthcare services more efficiently and effectively, and it's crucial that Canada learns from these examples. There is an urgent need for reforms to improve the quality and efficiency of healthcare in Canada. The system is not beyond redemption, but it will require thoughtful and strategic changes to reach its full potential. The Canadian healthcare system has its strengths, but it also has significant flaws that need to be addressed.